Hi, I'm Dr. Jeffrey Antimarino from Bellissimo Plastic Surgery and Medi Spa. Welcome for our monthly Facebook Live event. We're finally starting to see some little bit of hints of spring coming into the Berg weather, and so we kind of wanted to talk tonight about maybe trying to shed some of those little winter pounds that we put on, kind of that thought that we were keeping the pounds on just to help keep us warm in the cold months. So tonight we're going to talk about ways to shed those pounds and get our bodies ready for summer. So tonight I have a really special guest. I'm really honored that she's here. We're going to have Leslie Bonci talking to us tonight about food, nutrition, how to look at food maybe a little differently. Not so much that we're going to give up our love for food, but ways that we might be able to substitute some ingredients for others, making our food choices a little better, a little more healthy. So Leslie is the owner of Active Eating. It's a nutritional consulting company. She's been all over the world, probably several times, but she consults with not only people just like us, but major sports teams, the Steelers, the Penguins, Kansas City Chiefs. You've been up into Toronto, so numbers of professional athletes, but she's here tonight and we're going to talk about how do we get our bodies ready, how do we get that swimsuit look that we want, and I'm going to talk about some of the surgeries that we're doing now for that same thing. Every year, right out of winter, going into summer, there's a couple of different surgeries that are hot topics, and so we're going to put those together, but it's not all about surgery and how we can keep that look through the winter, again next year, the fall, and so ongoingly. So welcome to Leslie, since it's really an honor to have you here.
You know what, I'm thrilled to be here, and so as we talk about spring leaning, you know, this whole idea of people are like shedding it, like, oh my God, I'm going to expose myself now, and what do I do? But with that, oftentimes what happens is people get too extreme. What they're eating is, oh, I'm going to cut out all the carbs, or I'm just going to do this or that, and then they're exhausted. Oh, I'm going to exercise at the same time. Well, I don't have the energy to do what I want, and then they get frustrated. So I'm a very big believer in self-sustainability. We use that term a lot. We're concerned about the environment. This environment, this home environment, we need to think about it and make sure that we're doing things for the long haul. That is really the key. So it's lifestyle. It's not just this hand-to-mouth activity, but everything that surrounds that.
Right, and we were talking about there's a lot of fad diets out there, you know, for millennia, and they don't really work. Yes, you can lose weight. Yes, they're very successful in a very short period of time, but again, it's the sustainability. It's changing your lifestyle. I do a lot of reconstructive surgery after massive weight loss. So the lap bands, the gastric banding, the gastric bypasses, patients losing 150, 200 pounds really to get healthy again. But the studies show that if they don't change their lifestyle and how they eat and view food, after 3 years, they start to gain that weight back, and many of them are actually back to their weight they had before the surgery. So, you know, we can talk about it. You can blend anything and take in calories. So, you know, so let's talk about, you know, sort of that approach. We were talking earlier that there's a lot of information on the internet. There's a lot of this. Kind of go through some of the basic things, and you know, that why do these fad diets, why don't they work? Why are they so successful and then they fall off? And
well, I think the starting point when I'm talking to my patients about this is always start with that conversation about what are the variables that you cannot control. And one of those is age. That's a given. We can lie, but you know, there's that. It's our height. It's whatever it is. If we don't like it, we can wear higher heels or lower heels. And it's overall frame and body shape. So everybody's going to have a certain shape, right? So whether they're apples or pears or bananas, there's that. And it's either extra small frame to some of my athletes or extra large frame. That's their bones. We're not shaving those down. We don't want to do that. So sometimes people have unrealistic expectations. Oh, I carry more of my weight in the bottom of my body, therefore I'll do keto and all of a sudden I don't have a behind. Well, no, it doesn't work that way because dieting is not self-selective. So we need to think about those variables we can't control. Now, what about things we can control? The amount of fluid in our body, how much body water we have, how much muscle mass we have, and our body fat. We can control that. The problem with a lot of the fad diets is it's a lot of weight loss quickly, and some of that loss is muscle. Now that's non-negotiable. We really don't want to be losing that because you might end up a lighter person but a fatter person as a result. So we want that body composition to be the right way, and plus if it is too drastic, that's a shock to the body, and it's very, very difficult to maintain that. So when you ask me, it's like, what would be a first step? I think people really need to be as selective, especially women, but men too, as selective with your diets as you are choosing a pair of shoes. Because I know what that is like for me. I got to try them all on and what's comfortable and what looks good and what looks hot and all those kind of things. And some don't feel comfortable, right? So we don't, oh, well, I'll just do this diet. If it's not a comfortable fit, you're not going to do it. Secondly, does it actually have foods on it that you like? Because if you don't, that's going to be a problem. Does it require a tremendous amount of money? Because that could be an issue, or a tremendous amount of time. But most people are busy, and most of us don't want to have to devote 5 hours a day to preparing this and packing this, and no. Mm-hmm. So those are things that are critical. And then also looking beyond that, how many times a day are we eating or not? Does that eating plan work around our work day and our physical activity? Are there things there that look so obscure? I could not possibly eat that. All of those things. And is it more inclusive than exclusive? Is the list of what you can't eat a lot bigger than the list of what you can? You're going to look at that and say, maybe a day, and then I am done, and we're going for the cheesecake. It just is that way.
No, I'm in that same bucket, So, so I mean, you have good days and you have bad days, and so I think that's the other thing, is that we get unrealistic expectations of what we want to do. I mean, there's many times patients will come to me and they'll say, well, I want to do this surgery, but I think I just want to lose 40 pounds first. And my follow-up question is always, why 40 pounds? What's so significant about 40? What about 30? Are you going to be unhappy at 30? Are you going to be, maybe you need 50? How do you know? And a lot of times it's because that's my weight, in high school. That was my weight 20 years ago, or my weight before kids, but our bodies have changed since then. So I think that's the key thing. You have to be realistic, and I like the fact you have to say, you sort of have to put it into your lifestyle, because it's like anything else in life. When you want to succeed, you'll succeed because you have a number of small successes leading to the overall success. And I think that's a problem, at least I know that I have. You're good for a while, willpower only goes so far, then you backslide, and then you try to get back on it, and then you backslide, and then pretty soon it's like, oh, the hell with it. And
well, and some of the diets, like Whole30 in particular, there's no margin for error. None of us live our life that way. None of us are perfect with our eating, and I typically say to my patients, if you can do this 70% of the time, that's pretty darn good. And the other part of that is we don't want unintended consequences. Oh, I followed keto and now I have atrial fib. Okay, that wasn't in the fine print. Or, oh, I've lost some muscle. Well, no, those types of things we don't want to have happen. So, really thinking about this a little bit differently. If all the scales disappeared off the face of the earth, I think most people would be jumping for joy. I mean, truly, they would. How else would we assess? Maybe it's circumference measure. If somebody says, I'm starting to exercise more, the number on the scale may not change dramatically, but ooh, I feel sleeker, I feel fit, I feel toned, I can see definition in my arm because of those types of things. That is as important. So as we get older, we can throw that suitcase up in the bin without any help.
Right.
I brought in a 90-pound mattress from the UPS guy today because he would not bring it into my house and give it to me, boom, right in there. He was very impressed. So yeah, it is very important.
Well, I think that's the problem I have with BMI as well, because it's misleading. You can't just look at one factor and say this is the overall idea of people that are healthy or fit or their best the best fit for them, because most of the athletes that on the BMI, they'll all be obese.
They would be. And granted, some of them are, wiggling maybe a little bit more than they should, but that's the way it is. If they're tiny, they're not going to be out there on the football field because they would get killed. And, there are also, several, my gymnasts or some of my figure skaters, some of my ballet dancers, they're very, very tiny, probably extra small frames because that's the way that they are. But there's a range, and that's why we need to take that into account more than just a number, a label, even a clothing size, all those types of things. Because if we don't achieve that, oh, I'm a failure. No, probably not a failure because you've made some positive changes. Or when we look beyond that, blood pressure lower, blood glucose lower, blood cholesterol lower. You can't put a number on that, but that is critically important for lifelong health.
And again, now you're looking at the healthy, the multiple factors that lead to health. And that's when I lecture to weight loss groups, the first thing I say is, you've lost this weight not to look better, but to really feel better and to be healthier for a longer, better life because you're healthier. And the other thing I hate is the ideal body weight. And patients will say, what's my ideal body weight? I don't know. I don't know that there isn't an ideal body weight. It's really, for me with patients, is tell me what body weight you can maintain so that I can evaluate you for a particular surgery. I don't want you losing 30 pounds, do these crash diets and we do a surgery and then you gain the weight back because it's unsustainable. So I think that's what you're saying as well. It's really about every individual, the health and everything. And I'm not to throw my colleagues under the bus because I'm included in this, but we talk to when patients want to go on these diets, we always say check with your doctor, and you should, because again, some of these fads or these supplements may be detrimental to the medication you're taking or the health conditions that you already have. Now, I can tell you, we don't get a lot of training in nutrition, almost zero. I mean, maybe I was absent that day, but we don't get trained a lot of that as a medical doctor. So your doctor may not be the one to help you get on this path very much, but they can certainly guide you as to what is okay and what supplements. So I think that's where people like you come really into play. We have financial advisors, we have other people. We really do need somebody that can sit with us and say, okay, what's your lifestyle like? And we just did this with you recently, is, what's your day like? What do you do day to day? What do you eat on a normal day? What do you eat on the weekend? What's your goal, realistic goal? Do you want to gain muscle? Do you want to lose weight? Do you want to lose inches? So you really do, and your doctor's not the end all be all. And I'm sorry, but the guy at GNC isn't the end all be all either.
No. And it's really the idea of being a food advisor or food coach. That's what I do, and I'll put that in the athletic framing because I spend a lot of time with professional athletes. But it's not just a meal plan. I'm going to do that. I want to hear what people are doing. I need to customize and personalize it, and that is the trend in eating right now. But that also means, and a registered dietitian will do this, is taking into account what underlying health issues there might be. If somebody is on medication, what would be a problem in terms of food that might interfere and or supplements that might interfere. The goal of the person who's working in a supplement store is to make a sale. Gold card, buy 5. Okay, that could be a problem. And we don't want to incur additional problems as a result. I feel, and I'm a little biased about this, but I think the money invested in working with a registered dietitian is worth every single penny that it is, because you come out with something now that is tailored to you. You have somebody else in your corner right now to go to bat for you, to be your advocate, to sometimes say, what were you thinking? Drop the Oreo, whatever it might happen to be, but to really be helpful.
Right, and you're not there to admonish them, but what's your goal, what's your thought on supplements, with vitamins? I mean, and my feeling is, if you need that, if you're lacking in that vitamin, you're lacking in that supplement, then I think they're good to take. But I think most of it, we're sort of intended to take it through our digestive system, not swallowing a pill, and that comes a lot from my burn training, where trying to give somebody a lot of supplement through their veins and arteries because they couldn't tolerate a diet because they were burned. They didn't do as well. So same kind of concept. Maybe I'm wrong, but what's your...
Well, in general, we talk about supplementation primarily for people who have a deficiency because you've had blood work that indeed indicates that. Perhaps your ferritin levels are low, perhaps your vitamin D levels are low, perhaps your B12 levels are low. But even if they're low, it's not supplement to the exclusion of food. Supplements are supposed to be a complement to food. So if people say more is better, that's very expensive urine, that is money down the drain. We don't want to do that.
That's right.
And if somebody says, if I'm taking vitamin C as a supplement, for instance, okay, the only thing you're getting is vitamin C. If I eat an orange, that's vitamin C, that's all of the phyto or plant nutrients that are in it, it's the fiber, it's the fluid, it's a lot of things that I'm getting in that food that supplement simply cannot do. So sometimes like there are people I think might need a little bit more omega-3. Not everybody eats salmon every day, they don't want to do that. Even sometimes probiotics, but it's not probiotics just in a supplement form. Are you eating foods that have live and active cultures? Can we get the best out of all of that? So more is not better, or as I always say to my athletes, just because you can buy it doesn't mean you should try it. So that's one of those things that's critically important.
Yeah, no, I like that. That's good.
What is your biggest piece of advice for those looking to lose weight and get in better shape in a healthy way?
So I think most importantly is that we've got to be realistic with what it is that we do, that we want to make haste slowly. So rather than overhaul the day, and to change everything at breakfast, lunch, and dinner, is pick the problem time. Play to your weaknesses, not your strength. So if somebody says, my problem time is afternoon, then that's the one we work on. Or my problem time is after dinner. That's the one we work on. If your breakfast is already good, why would you change that? That's just unnecessary. And then the other thing is, think about what you might be willing to give up. For instance, if somebody says, I drink a lot of sugar-sweetened beverages, I put a lot of sugar in foods, I use a lot of dessert, what could we do a little bit less of? Not gone, but a little bit less of. And then the other thing I always tell people is the wonderful idea of swap for. So what is the thing you really want? So for me, I would say, I would like to have a glass of Sancerre or Pinot Noir or Albarino or something as part of dinner. And I'm willing to have, not an alcoholic, I'm willing to have like a little bit less pasta or a little bit less rice because I want that to be part of my plate. So that way, rather than say I can never have a drink again or I can never have a cupcake again, is how can I negotiate that? We've got to be our own attorneys. And that really is important, is do that self-negotiation and then make those deals with yourself the right way.
And I think that's, for me, especially with the, talking about surgery, I get patients coming in a lot that say, look, I've gained a lot of weight, I've had it hurt my knee, so I need you to do liposuction and suck all the fat off me. And that's, it's not a weight loss program, it's a body contouring program. And we all do have areas of our body that, despite exercise and nutrition as we get older, that are just genetically predispositioned to sort of store that fat. And that's where the surgery comes into play. But then, we can, through small incisions, actually contour those areas, mostly the hips, the belly, and you can do liposuction from head to toe, those areas. But again, it's not a weight loss. So we can use it to debulk, we can do it to sculpt, and through very little downtime. But then, I always have the conversation, okay, now we have to maintain it, because liposuction, just like gastric bypass, helps you lose the contour for liposuction with the weight in the gastric bypass, but it doesn't preclude you from gaining or losing weight more. And so the question is always, well, if I have liposuction, can I gain it back? And yes, you can. You'll gain it back more uniformly, but you still gain weight if you're not watching what you eat, if you're not careful. And there's nobody that I know of that doesn't have to watch what they eat, to a point, just like you were saying.
Right. Very few people in this world get a free pass. And interestingly to me is even clients that I see that maybe were, looked like pencils or straws growing up, and then all of a sudden it's like, what is that? And they're just like bewildered. I don't know what to do. I don't know how to handle it. I think most people have probably been through an experience once or twice, or maybe more than that, of trying to make changes. But the other aspect of that too is what's happening as we get older. That weight's not storing in our pinky toes. It's that deep fat, that visceral fat, and that's the one that, from a health standpoint, we're more concerned about. But from an eating standpoint, it's much more responsive to changes in eating than the weight that might be, around the button of the thigh, right? Yeah.
And so,
that's a positive. That's
right. It is, and that's, for us, it's great because that's what the liposuction tackles. It doesn't counteract the old-fashioned beer belly. So all of that internal visceral fat, the liposuction, we can't get to that. But all the stuff on the outside, we can get at, and that's the harder one to control, like you said. So, so for me, at this point, liposuction, I mean, there's lots of patients coming out that are sort of shedding the sweaters and the coats, and now it's hips and bellies and thighs and arms, and it works great. But again, kind of taking them through changing their ideas. And you were talking to us before, you know, the Greek yogurt, as far as, you know, kind of using that instead of some other things like sour cream, and, you know, give me some of your sort of cheats like that, you know, because you're not sacrificing taste.
Yeah, I mean, I think everybody wants to enjoy what we eat, right? That's a really important kind of, oh, this tastes obnoxious. Well, then chances are we're not going to do it more than once because we don't want to. So when we think about food, it is the aroma of food. It certainly is the visual appeal or not of what we're having. It is also the mouth feel. Does it taste creamy,
Texture.
or is it watery, or is it, you know, the texture? So I love Greek yogurt. We use it a lot and just eat it as it is, but in other ways, to use it as a replacement for a sour cream. So if somebody says, I want to make a dip, and I'll make that dip using plain Greek yogurt and add some flavorings into it, it tastes just like a French onion dip with sour cream, but you've added something with a lot of protein, fewer calories, and you get that satiety because of the protein that's there. Right. That one works beautifully. Now we also have on the marketplace so many choices, from the riced cauliflower, or finely chopped cauliflower, to the veggie noodles. It doesn't mean 100% that, but if somebody says, I'm doing part of my plate that might be a semolina pasta, and part of it might be a zucchini noodle, well, you're getting more vegetables to your eyes. It doesn't look like you're starving, and the calorie load is significantly lower in that. I love the idea of pureeing beans. We used cannellini beans and others a lot because it adds the thickness to a sauce, and you get that oomph, that fill up but not fill out factor without altering the taste at all. And then definitely the idea of being a spice girl or a spice boy, those things, we've got to do that. When food is bland, it's like, yuck. So, you know, that idea of even some of the za'atar and some of the other wonderful spices that are out there, you heat them up in a pan, it actually unleashes the volatile oils. You get much more flavor out of it. You put your protein in there, and you are good to go. Simple thing that work very well. Even toasting nuts, you get more flavor out of them when they're slightly toasted, and then if it's more flavorful, we're satisfied with a little bit less, rather than, oh, I had to have a 5-pound jar, which is probably not what we wanted.
So in other words, even if it's healthy, you can overeat healthy food still.
You know, and this is the thing, right? People say, oh, dark chocolate is good, oh, therefore I need a 5-pound bunny, right? Or, you know, nuts are great, so let's go to Costco. And I mean, and it's also, a lot of times people hear this, and I will say, even as health professionals, sometimes what we say, it's not clear to consumers what they should be doing. So if somebody says, I'm going to add red wine, that's not just an add, and it's in place of something else. Or if I'm doing peanut butter, that is in place of something else. Otherwise, you end up with probably significantly more calories, and we can't exercise enough to burn that off.
Right. Okay.
Tell us more about your concept, foodies versus foodies.
But, you know, I love the idea of people being foodies. I mean, it can be in lots of different ways. We're not all going to be 5-star chef. We're not all necessarily going down to the Strip or Whole Foods to shop all the time. But, you know, it's the idea of enjoying what we eat, of sitting down, nourishing and nurturing ourselves with the food that we put into our body, without or, you know, like a little guilt monster on the shoulder saying, what were you thinking? Don't do that. And so what happens with a lot of the diet plans out there, it's foodies. This is bad. Gluten's bad, dairy's bad, don't have sugar, don't have this, don't have that. Right. And if we buy into that concept, then along with that comes a tremendous amount of guilt. Right. And that's a problem, because then you're like paralyzed. And this truly is this whole idea of food fear right now. It's, it had this, or it had this, or this list that came out last week from the Environmental Working Group. It's like, that's not a reason for people to stop eating produce. Wash it off. It's fine. That's the foodie part of it, and that just needs to go away. We've got enough contention out there. We don't need battlegrounds at the dinner table. We don't.
I have a question that came in from Heather. I try so many diets and I'm having such a hard time losing weight. I count calories. I've done exercise. I've done keto. Any suggestions?
You know, Heather, that is not an uncommon thing. I see that with my patients all the time. And the first thing that I would ask you to do is to really write down everything that you were doing over the course of the day. Everything. from the fluids you take in, to what it is you're eating, to how much you're having, to when it is that you're having it. Really get a snapshot of what's going on for a couple of days, because we all have patterns of what we do. And then instead of being extreme, this whole idea of negotiation, it's like spring cleaning. Okay, 3 piles. Here are the foods I absolutely cannot give up. Here are the foods that if I never have them again, I'll be fine. And here's my maybe pile. And the idea is maybe as part of every meal, it's maybe 2 or 3 bites less. That's it. Not drastic changes, but at the same time, critically important to make sure that every time you eat, there's some protein on the plate. Whether that is fish or poultry or beef or tofu or egg. Every time you eat, there's some fiber on the plate. It's hard to do that with keto because you're not eating a lot of high fiber foods. And every time you eat, there's something that you're drinking. So the whole idea of enough protein, enough fiber, enough fluid can really be helpful in terms of making the body work harder, that little additional push, and you won't be hungry.
Good. The other thing that I wanted to bring up, and we've talked about it recently, is the difference between juicing and smoothies. And taking all the vegetables, and juicing them, and then you're really just getting the fructose and just the calories from it, but you're not really getting all the nutrition that you think you're getting out of that. And you set me straight on the difference between that and smoothies, which is sort of complete concept. So if you
and there are some juicers that people use where it is inclusive and everything's there, but for the majority of them, you're leaving the pulp behind. So there's the fiber, there's the chew, there's the fill, so that basically you're just getting the liquid, and it's not as satisfying. When you do a smoothie where you're just going to put the fruit and the vegetables into the blender, you're going to blend it all up, it's exactly the same amount of fiber, whether it's pureed or whether you're eating it by itself, and maybe you're going to add something else to that, like a little bit of protein so you're feeling fuller for longer. The one thing that I think is critically important for people to realize, it's a lot easier to drink several pieces of fruit than it is to actually eat them. So there is an upper limit. So if the smoothie is the size of a vat, that's probably not a good thing. We're really looking at something along this line that might be 1 vegetable, maybe 1 or 2 fruits. Using the frozen fruits will make it frothier, so that tends to work better to do that.
Okay. Good.
You were talking about liposuction. Is there a goal weight for liposuction to be effective?
Again, so I guess the 2 most common body contouring surgeries right now, I see a lot of patients for liposuction and tummy tucks, and notoriously they get mixed up of what both of those surgeries do. So, and again, I don't think that there's an ideal body weight. I would like to see you at your weight where, as we're talking about, with your day-to-day normal activities, your day-to-day eating habits, whether that's some breakfast, a lunch, a dinner, some snacks, wherever you are right now, come on in and let's take a look at it, because then I can evaluate you, because that's your norm right now. And we can do small things to change it, but we're not, again, going to make you go out and start running 5 miles a day and not eating and go to these keto diets. I want to be able to evaluate, because then I want to understand what your goals are. And so if you come in and say, I have a lot of extra skin because I've lost weight and I've maintained that weight, then the tummy tuck would probably be a better choice for you, and remove that skin and really contour your body and shape up the abdominal wall and give you that nice flat belly again. If it's somebody that comes in and they've had kids, and the kids are running around and they're just not back to their old lifestyle, but this is their new normal lifestyle, then at this point it might be the fullness of the belly, the fullness of the hips, where you're just not looking good in clothing. And so then liposuction would be a better choice, because now you're going to debulk that area, and again, not to lose weight, but to look better in clothing. And I really like as you're talking about, there's a lot of success that can be done in life by small psychological successes. And so I love the fact that you're saying, don't change things drastically. Do little bits at a time, and then when you get used to that, you can change a little more and a little more and a little more. And the same thing with the surgery. We're not going to change things drastically. We're going to cut that skin away. We're going to reshape you and redo the sort of that contouring. But again, we want to maintain that. We want to keep you, maintaining that look that you like so much, that makes you feel psychologically better. We want to promote that so you're doing more. And so it's not uncommon, honestly, for my patients that we do that debulking liposuction to now go on and start losing weight because they feel better. They don't feel so self-conscious at the gym or out running where they feel like things are kind of bouncing around and everybody's staring at them. So it's a great motivator, but that's what it is. It's a motivator to keep you going to be your best self, and that's
kind
what
of like the
doing.
appetizer, right? And then
Right.
you're still your lifestyle choices are the entree. That's what sustains you when you do those things regularly.
Right, and there's some photos that we're just putting on the website of a gentleman that did that. I did some liposuction on him, and he felt better, and he started working out, and now he's been working out, and his transformation is tremendous. And he doesn't do it with these crazy diets, and he doesn't, kill himself at the gym. But it's been a year-long process. But he's just a new him now, and that's the key. Is I want you to be so comfortable with yourself that you're just more outgoing. You have that energy because you have not only the physical energy but the psychological energy that just makes you feel good about who you are and where you want to go.
Well, and to that point of people who want to multitask, especially in the springtime, it's nicer outside, there's not ice, so I won't break a hip, all those types of things, and I'm going to train for a marathon, and people are doing this kind of exercise with that kind of eating.
Right.
No, or you're not going to be able to get through your workout, or you're going to drop a weight on your toe or something.
Right.
So we really have to make sure that those balance out. This activity and this activity really need to marry well together. It's important.
They do, especially for people that, we're not 18, 20, 22 years old, where just about anything you do, you can kind of lose the weight. But you start getting into your 30s and everything, you can't just exercise a bad diet, and you can't, eat so clean, then you're not exercising. They don't work as well, but you do have to have the combination of both of them. And you don't have to kill yourself on either one. You just sort of have to get into the mindset of doing it.
And then the other component above and beyond whatever the activity is and the eating is the habit. So if somebody says, nighttime's a hard time for me, or I need to work on portion, it literally takes 3 months for eating habit to change.
3 months?
Yes, you don't change them right away. So
I give you 3 days.
Right, you know what? And that's the other reason that the fad diet, they don't think about that at all. And if somebody's gonna, just keto or do whatever, if you don't change those underlying habits, you're gonna be right back where you started at some point sooner than later.
Okay, so I got it, because I know we're going to be, I don't want to miss this when you guys give me the close sign here. This is something that bothers me. Everybody in my family will say it. It bothers a lot of people, because I talk to my patients about it too, because we talk about this when we talk about body contouring. Nighttime cravings. Okay, it is the end-all be-all. You get to about 9:30, 10 o'clock, you're still up doing stuff, you're still working, you start getting tired, you start thinking you're hungry. First thing you think about is salt and sugar.
With some fat. Fat's usually...
So what do? You leave the Oreos behind, do what? What are some ways that we can try to muscle through that 3 months?
Yeah, okay.
to change
so,
that.
You know
what do we do?
Right, and I'm not a huge fan of protein shakes per se, because I think for most people they don't need them, but they are sweet. They do taste creamy, and rather than having it first thing in the morning where you're ready to eat your arm an hour later because it didn't give you sustenance, if you have it at 9:30 or 10 at night, chances are it's going to be sooner to bedtime than would it be if you're trying to work through the day. Something like that. Something that you actually have to use a utensil for, like cereal in a bowl with a spoon, so you're not putting your nose in there and grazing like a horse, those types of things, because it makes you slow down. If somebody says, I want the idea of something crunchy, even something like we talked about, the yogurt dip or something like a hummus, it doesn't have to be a pita chip, and it doesn't always just have to be a carrot butt. There are companies now that do it like it's like a carrot chip. They're really very good and crunchy, or a beet chip. It's actually the vegetables freeze-dried, but it gives the crunch, or a bean chip that's just made from a bean. It gives give the crunch, and it takes a little time to eat through that. And if you say, all right, I'm going to put some hummus in a bowl, not a vat, and I'm going to have like a little bowl of chips I'm going to have with it, and the bag goes back, the hummus back in the fridge. You sit down and you eat
put
it.
The bag away before you start
Yeah,
eating.
if not, I take it into the television. We're like, no, or oh, what are all those crumbs on my computer? See, we can't do that. So, that whole idea of trying to portion it really and taking the time to eat it, and really then taking that break. I'm taking actual time to nourish myself. So I'm away from the computer screen where my eyes are being diverted otherwise, and now I know what I'm eating. You're really going to know what you eat. You're going to feel more satisfied with that, rather than this thing going on while we're trying to multitask.
Right, it's
one
not,
hand here, one hand there.
How many handfuls you've had.
Exactly.
Until you get to the end of the bag and think, oh my gosh, I just ate the whole thing.
Right. And then the other thing, if people say, I know evening is my hungry time, late at night, then even thinking about that before that in your dinner meal. Can we negotiate? Could we maybe say, I'm going to try to have 3/4 of what I normally would have, so I'm actually saving those calories. So you're not necessarily adding in more calories, but you're saving some of them. So at the end of the day, your calorie load still ends up being appropriate. You haven't overconsumed.
Okay. Is there any validity to the fact of eating too late at night? I don't have the problem of eating and then going right to sleep. I can fall asleep with a drop of a hat.
Yeah.
But is there? I mean, there's sort of this idea out there that you shouldn't eat past 9 o'clock because your metabolism, if you're going to bed at 10 o'clock, you should stop eating an hour or two before that. Is that true, or is that?
So when we look at food consumption patterns around the world, there are countries of the world, particularly in Brazil and also in Spain, where you go out to dinner at 10 or 11 o'clock at night. They don't eat at 7 o'clock. It's not what they do. They eat late. So it's not just about the time, but certainly what it is about is what does your overall distribution of calories look like? If you have met your calorie quota by 7 and then you keep eating, that's excess just because it is. The other thing, though, is that we know that the highest incidence of both heart attack and stroke are late night, early morning, and that usually tends to be correlated with the biggest volume of food being consumed in the evening time. So that doesn't necessarily mean breakfast like a king and dinner like a pauper. Not everybody wants to do it. But that idea of putting some boundaries around how much we might be having, and just from the digestive standpoint, so we're not going to bed with a full stomach. I can't do that. I mean, no. I need time. I can't, otherwise in my nostrils, I don't like it. So, like about an hour and a half before, that's usually my cutoff. If I'm going to bed at 11, by 9:30, done. And I will tell you that right now what's very popular, this idea of TRE, which is time restricted eating, or IF, intermittent fasting, of what people do. And basically you're eating in certain hours of the day, and you're kind of minimizing the extra stuff. So for people who tend to be nighttime eaters, that doesn't mean they're not eating dinner. They say, I won't eat anything after dinner. Well, they're eliminating some extra calories, and they may see weight loss because they've decided that their hours of eating are going to be before that. When people do that, what I think is really important is you need to pick your hours appropriately. So, I'm going to eat between the hours of 8 a.m. to 2, but I'm going to work out at 5 p.m. No, because you have to make sure at least you parenthesize during the time of the day when you need the calories the most.
Okay. Sounds good.
In correlation with a surgical procedure, is there anything you would suggest to help with the recovery as far as nutrition? Is there suggestions you would make to the foods that after surgery to help you with your recovery?
There are some things that have been looked at from the anti-inflammatory perspective and overall supporting a healthy body. So we talk about protein being critically important, and what a lot of people do is they might say, my Fitbit or whatever, my FitnessPal tells me to eat 60 grams of protein a day. What that does not mean is 0 at breakfast, 5 at lunch, and 55 at dinner. It means even distribution over the day, like 20-20-20. So that's a very critical component of muscle protein synthesis as well as healing. We need to do that. The second thing is of those items that are anti-inflammatory, of truly what has been shown in the literature right now. It is pomegranate, it is beets, it is berries, it is the fatty fish, those are the big ones that really do confer an anti-inflammatory effect, in addition to ginger, saffron, and turmeric. So when people add some of those things into their diet more regularly, so if I'm doing salmon in place of the pork chop, if not both, or maybe I'm grating some turmeric to use that as a flavoring on the food, or I'm doing a pomegranate juice instead of some red wine, then yes, I mean that type of a thing. So we're not adding them on to the day, but we're swapping those out strategically for other things.
Okay. That's good to know. The only time that I really stress, most of my patients are healthy patients with pretty good eating habits, so they're not really lacking anything anyway. So I usually tell them, for the surgeries that I do, there's nothing really special. I don't want you doing any special diets because that's not what you're used to anyway. So just sort of eat the way you normally eat, but as long as it's pretty clean. And again, it's not trying to eat all vegetables and everything else. The only group of patients that I worry about, I talk to them about, are my gastric bypass patients, because the small intestine has been severely shortened and sort of rerouted, that those patients lose weight because they're almost in a starvation mode. It's because the transit time through your small intestines is so short, you really don't absorb much. So those patients always have to be worried about anemia. They always have been, so you need the iron. You always have to be worried about vitamin B deficiencies, and you always have to be worried about protein intake. And so for those patients, and their stomach is so small anyway after that surgery, you can't possibly eat enough because your stomach volume just isn't big enough. So you can't eat enough chicken or steak or liver or whatever it is you're going to eat for the protein. So for those patients, I have them do protein shakes. And usually, and again, because it's the volume and it's thick, and so it is pretty satisfying, and it kind of satiates you, as you're not as hungry when you're eating it. But what I have them do is, I know they can't drink the whole thing at once, so take it out, take a few drinks, put it back in the refrigerator. Every time you sort of pass by the refrigerator, take a few drinks, so that you're getting about 50 or 60 grams more than you normally would. And what I find for those patients, especially with a lot of the abdominal surgery that I do, where there's drains involved, most patients will, after a tummy tuck with the drains, the drains are usually out in a week or two. With gastric bypass patients, they might be 3 to 4 weeks because of that protein. So with that, again, they actually get the drains come out earlier, they heal better because they can't possibly manufacture it. And when you don't supply that, guess where they get it? They get it from their lean body mass. And so a lot of those patients are actually more tired. They don't get back to their lifestyle quicker. When they go back to the gym, they've lost so much tone, it takes them longer to get back to the lifestyle. So those are the patients that are really harp on to really look at their nutrition, because your body will get the protein, but it will scavenge everything in its sight to get it, including itself, to get what it needs. You have to provide those building blocks.
And that's why the idea of things that are semi-solid work beautifully. So even if somebody's using a protein isolate, even an unflavored one, and you can add that to a fruit and vegetable smoothie to get more protein into it, so you're getting the fruit and vegetable without the chew and the big volume because of that tiny amount of available absorption space that you have. Or what I've done sometimes is have people actually put things into popsicle molds and do it that way. So it's like a cropsicle. So you can do that type of a thing of getting the benefit of the protein and the produce in a popsicle.
Great.
Speaking of surgeries, what's the recovery period like between the tummy tuck and liposuction?
Liposuction is the quickest downtime of any of the surgeries, because the incisions are tiny. We're using about a 4 millimeter cannula to remove the fat. So you're looking at incisions about this big. Most of the time when you liposuction the abdomen, it's usually 3 small incisions, 1 just above the belly button and 2 on the lower abdomen. And then usually 2 on the lower back to get to the hips. If you're going to do your upper back or your thighs, again, they're just small incisions. But there's not a lot of dead space, meaning there's not a lot of dissection because the cannula does all the work. So for those patients, a lot of times they're back to work within just a few days. And even if we do abdomen, back, and hips, you're back to work in a few days. Most of those patients I have back to the gym between a week or 2, depending on when you feel comfortable doing it. Now, the abdominoplasty or the tummy tuck is a little bit different. It's a longer incision. You actually separate the skin and a little bit of fatty tissue away from the muscle wall. You don't go into the abdomen, you stay on top of the muscle, and you separate that because you want to pull down that skin as much as you can and recontour. So all of that tissue needs to stick back down, and so it's a big area, and that's why the drains are important. So the downtime for that is usually about 2 weeks before I let you get back to work, and at 3 weeks I'll let you get back to some exercising. Most of the time it's about 80% of what you normally do. I don't let anybody do any running, jumping, or jogging for about 6 weeks, because that's when the scar tissue is in place. And but at 3 weeks I get you back to Stairmaster, elliptical, spinning, cycling, swimming, and a lot of weights other than the core. So after a tummy tuck, I don't let you do any core exercises. Most patients aren't ready to do it for about 3 months, but you know, with the tightening of the abdominal wall, it's like doing 1,000,000 sit-ups all at once. So you're pretty tight, everything's pretty toned, so it's usually not a problem.
Can you touch on Kybella and where that falls into place with the...
So that's a new, relatively new. Kybella's been out for a number of years now, but it's actually a chemical that is found in the gallbladder, and the gallbladder's function is to actually help your body digest fat. So there's a sort of deoxycholic acid that actually breaks down fat, and the Kybella is the chemical nature of that. So we can inject Kybella into certain areas. The most common area when it started was just under the chin. There's a little bit of this fatty isolated area here. But we've now using it for, lots of ladies carry it right in front of their armpit. And so they get this little bit of a bulge, which really bothers them in a bra, especially in a bathing suit. The banana rolls, which is the lovingly word for the rolls just underneath the buttock, right at the top of the thigh. So right where the buttock and the thigh meet, that little bit of a roll there drives a lot of women nuts. Again, bathing suits give away everything. So Kybella in that area, and so the Kybella actually just dissolves the fat in that area. So there's not a lot of downtime. There is about 5 to 6 days usually of some swelling. We do it right here in the office. So there's no downtime there. You can have it done in a relatively short period of time and go back to work or go back to activities. And then it generally takes sometimes 2 or even 3 visits to do that, and we usually wait a good 4 to 6 weeks in between treatments. So it's sort of an ongoing process. As opposed to one of the things that we talked about with liposuction, it's sort of a one and done deal, which is kind of nice. But some people don't want to undergo surgery, and that's okay. Kybella is a pretty good alternative, although it doesn't, you're sort of waiting for that chemical to work and see how well it works. But with liposuction, I can feel right there how much is coming out and contour right there on the spot. So personally I like the liposuction better. I'm a surgeon, but I can actually feel it and contour it right there. I have the control. I know when the stopping point is, the symmetry. With the Kybella, you're just sort of waiting for the chemical to work, and then the next one is to sort of a reaction to what you did on the first or the second stage. The other stages are sort of in reaction to that.
Any closing tips you'd like to give on nutrition or surgical procedures?
If you had one closing tip, what would you think?
We have to enjoy the food that we eat. That is so critically important. We talk about it not being a battleground of, why shouldn't we do this? This is the gift that we give to ourselves. Keeping our own house in order is, forget some of that nonsense. If it sounds too preposterous, don't do it. Right. And be as consistent as you can 7 days a week. If we fool it, what the body knows. It's much smarter than we give it credit for.
Great. Well, listen, thank you so much for visiting us with us tonight. It was, again, a real honor to have Leslie here. I'd like to have her come back. We'll do some more segments, so please give us some ideas of maybe some other topics that you might want to hear her touch upon. And next month, we are going to be talking about Kybella. We're actually going to do a Kybella demonstration, so if anybody wants to see it, please tune in. That's going to be April 30th. That, again, is a Tuesday night. And thank you again for joining us tonight. You can follow us Facebook, Twitter, Instagram, certainly our website. And so join us at any time on the website. If there's any other information that you need, please email us, and we'll be certainly happy to give it to you.